Breaking news. Okay, anyways. We started a new follow-up form, and we got about 1,700 follow-ups so far, and the last one was 20 minutes ago, so we're looking at it live. And we've added some new questions, and I thought you might want to hear the latest news, because I think it's pretty cool. So I'm going to click on this and see how my internet connection is working. And what we wanted to know is, we have a lot of information. I think we've told most of you about our information on weight loss. Our weight loss is great. We can tell you the average weight and the average weight loss at 1 month and things like that. And we have some post-op patients here, and maybe we'll, if I ever do stop talking, which is a significant question, then we're going to ask them, maybe they can make some comments. But one of the things we weren't sure about, that we wanted to ask, was we said to ourselves, gee, how many of our patients have friends or family that had a Roux-en-Y? And if you have friends, family, or acquaintance who had a Roux-en-Y, tell us how they did. Just give us an update. And then the same question on the lap band, and then the same question on the MGB. Okay? We kind of know what that's going to show. Because we're the best. But we thought we would do a survey and see if my biases were kind of matched with the data. So I thought I'd give you that result because it's pretty exciting. In our database, we got back a bunch of information which matches our previous studies. So for example, our average patient's height is 5'6" inches. At the time of surgery, they weighed about 290 pounds on average. So there's some that are up to 400 and some that are as low as 200. And so here's our question, which is, have you, your family, or acquaintances had a Roux-en-Y gastric bypass? Okay? About 56% said no. So almost a little over half said no. But the other half did. And of that group, basically it's just about 30-30-30. 30% had a friend, a family member, or an acquaintance who had a Roux-en-Y who did well. Another 30% had a Roux-en-Y and a friend, a family member, or acquaintance that gained all their weight back. And a third group, also a third of the whole group, 30%, had a friend, a family member, or acquaintance who had a Roux-en-Y and had a major complication. So 30-30-30. About 30% did well, 30% gained their weight back, and 30% had a complication. Now the lap band patients had their surgery more recently than the gastric bypass, but again, roughly similar. Now they had about 64% did not have a friend or family member that had a lap band. So that means, what, 36%? Only a third have a friend or family member who had a lap band. But for that group, again, the numbers were, for the residual, about a 30-30-30 breakdown. It's not exact because they have a little bit more patients have a complication, a little bit bigger number have gained their weight back, and a little bit less than a third are doing well. So 60% chance, depending on how you define it, 60% of friends, family members, acquaintances who had a Roux-en-Y or a lap band did badly. And a third of both groups did well. Then we also asked them, what about a friend, a family member, or an acquaintance who had an MGB? 4% had a complication. 30%, 4%. And 3% had gained some of their weight back. And so again, about 50% had a friend or family member or acquaintance who had an MGB, so about the same numbers for each one of those. And the complication rate and weight regain rate much, much lower. So hot off the presses. So MGB's better. That's what we'll title that video. Totally unbiased.